Hello, everyone, and welcome. I'm excited to have you here today. We'll be exploring a very important topic: comfort, rest, and sleep and pain. This is the first slide of our presentation, which sets the stage for understanding how these elements are interconnected and vital for our well-being. Over the next few minutes, we'll cover key aspects of how comfort influences rest, how sleep impacts pain, and ways to improve both. Let's get started. Today, we'll be exploring the key learning objectives that will guide our understanding of comfort in nursing care. First, we'll delve into what exactly we mean by comfort and why it's so fundamental to patient care. We'll look at the various factors that influence comfort, things like physical, emotional, environmental, and psychological aspects that can make a big difference in a patient's well-being. Next, we'll examine different types of beds, their purposes, and proper bed-making techniques, since the right environment plays a crucial role in comfort and recovery. We'll also discuss therapeutic positions and comfort devices, which are essential tools to enhance patient comfort and prevent complications. Moving forward, we'll explore the physiology of sleep, why sleep is vital, what factors can disrupt it, and common sleep disorders we might encounter in practice. Understanding this helps us better support our patients' rest and recovery. We'll also cover pain, its physiology, causes, various types, how to assess it accurately, and effective management strategies. Pain control is a cornerstone of compassionate nursing care. Finally, we'll look at newer measures and complementary and alternative medicine, or CAM, approaches for pain relief, which are gaining recognition for their efficacy and holistic benefits. Throughout this session, the focus is on understanding these interconnected concepts so we can provide holistic, patient-centered comfort. Let's talk about comfort, which is a fundamental aspect of overall well-being. When we refer to comfort, we're talking about how well our physical, psychological, social, and spiritual needs are being met. It's about creating an environment where these needs are satisfied and we're not experiencing distress. Having comfort means that we feel at ease, safe, and supported, which is essential because the absence of discomfort or distress actually promotes recovery and enhances our well-being. Think of it as the foundation that enables us to rest properly, get good sleep, and effectively manage pain. In essence, comfort isn't just a nice-to-have, it's a vital part of healthcare. It helps us heal faster and supports us psychologically and emotionally. As we explore ways to improve patient care, understanding comfort helps us see how addressing these needs can make a real difference in recovery and quality of life. Let's take a closer look at the factors that influence comfort. On the physical level, things like pain, illness, the type of bed surface, and mobility all play a significant role. If someone is in pain or uncomfortable physically, it naturally affects their overall sense of well-being. Then, on the psychological side, feelings like anxiety, fear, and depression can also impact comfort levels quite profoundly. These emotional states can make physical discomfort feel even worse. Moving to the social aspect, having strong family support and good communication can really help improve comfort, especially in a hospital setting. When patients feel supported and understood, their comfort often increases. Lastly, the environmental factors such as room temperature, noise levels, and lighting are crucial. A comfortable environment can make a big difference in how a patient perceives their overall comfort. So, as we can see, comfort isn't just about physical factors. It's a complex interplay of physical, psychological, social, and environmental influences. Keeping these in mind helps us better address patient needs and improve their overall experience. Now, let's talk about the different types of beds and bed-making practices we encounter in healthcare settings. Traditional hospital beds are still quite common, but there are also specialized beds designed for specific needs. For example, air loss beds help prevent pressure ulcers by reducing pressure points, while bariatric beds accommodate larger patients safely. Smart beds are equipped with technology to monitor patient status and assist with care. The main purpose of these various beds is to promote pressure ulcer prevention, ensure patient comfort, enhance safety, and facilitate smooth repositioning. Repositioning is critical to prevent complications like pressure injuries and to improve overall patient well-being. When it comes to bed making, there are different types depending on the patient's situation. For example, beds can be made while the patient is still in bed, which we call occupied bed making. Unoccupied beds are made when no patient is in the bed. Open beds are prepared for new patients, often in the emergency or admission areas, while closed beds are ready for patient use with the linens neatly arranged. And then we have surgical beds, which are specially prepared for postoperative care. Understanding these differences helps us provide better care and maintain a safe, comfortable environment for our patients. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's look at therapeutic positions and comfort devices. First, there are various positions we can use to promote patient comfort and recovery. These include supine, where the patient lies on their back, prone, lying on the stomach, Fowler's position, where the head of the bed is elevated at about 45 to 60 degrees, semi-Fowler's, which is a slightly lower elevation, Trendelenburg, where the patient's head is lower than their feet, side-lying with the patient on their side, and orthopneic, a position that helps with breathing by sitting upright and leaning forward slightly. Each of these positions has specific benefits depending on the patient's needs, whether to improve breathing, circulation, or comfort. Next, we have comfort devices that assist in maintaining these positions or enhancing comfort overall. Pillows are versatile and can support the head, neck, or limbs. Wedges help elevate parts of the body or prevent pressure injuries. Bed rails provide safety and stability, especially for patients who might be at risk of falling. Adjustable beds allow for easy positioning changes to meet individual needs, and pressure-relieving mattresses help prevent pressure ulcers by reducing pressure points on the body. Understanding these positions and devices is crucial because they form the foundation of patient care, ensuring comfort, safety, and optimal healing. They tie into the overall theme of promoting patient well-being through proper positioning and supportive equipment. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's talk about sleep and rest from a physiological perspective. Sleep isn't just a passive state, it actually consists of different stages. Primarily, we have NREM sleep, which includes stages N1 through N3, and then there's REM sleep, which is quite distinct. These stages cycle throughout the night, each serving different functions for our body. Now, the regulation of sleep is influenced by two main processes. First, there's the circadian rhythm, which is our internal biological clock that helps regulate when we feel sleepy or alert over a 24-hour cycle. Then, there's the homeostatic drive, which builds up the longer we're awake and promotes sleep pressure, pushing us to rest. Why is all this important? Well, sleep plays a crucial role in various bodily functions. For example, during sleep, our tissues undergo repair and regeneration. It's also essential for consolidating memories, helping us process and store information we've learned during the day. Additionally, sleep supports immune regulation, ensuring our defenses are ready to protect us. Understanding these physiological aspects of sleep ties directly into the overall theme of health and well-being, emphasizing just how vital quality sleep truly is for maintaining optimal functioning. Let's talk about the factors that can affect our sleep and rest. First, on the physical side, things like pain, illness, certain medications, noise, and light can really disrupt our ability to fall asleep and stay asleep. These physical factors are often unavoidable but can be managed with some adjustments. Moving on to psychological factors, stress, anxiety, and depression are major players here. When our minds are racing or we're feeling overwhelmed, it becomes much harder to relax and get restful sleep. Recognizing and addressing these mental health issues is essential for improving sleep quality. Environmental factors also play a big role. Interruptions like alarms, roommate disturbances, or even unexpected noises can break our sleep cycles. Creating a quiet, comfortable environment can make a significant difference. Lastly, our lifestyle choices greatly influence sleep. Consuming caffeine late in the day, having irregular schedules, or spending lots of time on screens before bed can all interfere with our natural sleep rhythms. Being mindful of these habits and making small changes can really help us get better rest. Overall, understanding these various factors helps us see that improving sleep often requires a holistic approach, addressing physical comfort, mental health, environmental conditions, and lifestyle habits. Now, let's talk about promoting rest and sleep, which is so vital for overall health and recovery. One of the key strategies is maintaining good sleep hygiene. That means sticking to a regular sleep schedule, going to bed and waking up at the same times each day to help regulate the body's internal clock. Creating a dark and quiet environment is also essential because light and noise can disrupt sleep. Another important point is clustering care activities. By grouping tasks together, we can minimize awakenings during the night, allowing for longer, more restorative sleep periods. Managing pain effectively before bedtime is also crucial, as discomfort can interfere with falling asleep or staying asleep. Lastly, incorporating relaxation techniques can make a big difference. Guided imagery, calming music, and progressive muscle relaxation are all excellent methods to help the mind and body wind down. When we focus on these strategies, we're not just helping someone sleep better, we're supporting their overall well-being and recovery, which ties into our broader goal of holistic patient care. Let's talk about sleep disorders, which are more common than you might think. These include conditions like insomnia, sleep apnea, restless legs syndrome, narcolepsy, and circadian rhythm disorders. Each of these can significantly impact a person's quality of life. Key symptoms to watch for include daytime sleepiness, which can make it hard to concentrate or stay alert. Snoring is another common sign, especially with sleep apnea, and frequent awakenings during the night can fragment sleep and leave someone feeling exhausted the next day. As nurses, our role is crucial in managing these disorders. We perform thorough assessments to identify symptoms, conduct screenings to evaluate sleep quality, and make appropriate referrals to specialists when needed. Education is also vital. We need to inform patients about healthy sleep habits and possible treatment options to improve their sleep and overall health. Remember, recognizing these signs early and providing proper guidance can make a big difference in our patients' lives. Sleep health is a vital part of overall well-being, and our role is to support that through assessment, education, and collaboration. Let's take a closer look at pain, specifically the physiology behind discomfort. Pain is essentially an unpleasant sensory and emotional experience, which means it's not just about the physical sensation, but also how we feel about it emotionally. It's a complex process that involves different types, with nociceptive pain being the most common. Nociceptive pain can be further categorized into somatic, which relates to skin, muscles, and bones, and visceral, which comes from internal organs. Then there's neuropathic pain, which results from nerve damage or dysfunction. Understanding how pain travels through the body involves a pathway that includes 4 main stages: transduction, transmission, perception, and modulation. Transduction is where the pain begins. Sensory receptors convert harmful stimuli into electrical signals. These signals then travel through the transmission phase to reach the brain. Perception is how the brain interprets these signals, making us consciously aware of pain. Finally, modulation involves the body's way of regulating or dampening the pain experience, either amplifying or reducing it. Connecting this to our overall theme, knowing these physiological processes helps us better understand how pain can be managed and treated effectively. Now let's take a closer look at the common causes and types of pain. When we talk about causes, we're referring to situations like postoperative pain, which occurs after surgery, or trauma, such as injuries from accidents. Musculoskeletal issues, like joint or muscle problems, are also frequent causes. Additionally, cancer-related pain and neuropathic pain, which results from nerve damage, are important categories to understand. Recognizing these causes helps us tailor effective pain management strategies. Moving on to the types of pain, we see a range that includes acute pain, which is sudden and usually short-term, and chronic pain, which persists over longer periods. Then there's nociceptive pain, arising from tissue injury or inflammation, and neuropathic pain, caused by nerve damage, often more complex to treat. We also have breakthrough pain, which is a sudden flare-up of pain despite ongoing treatment, and phantom pain, experienced in limbs or body parts that are no longer there but still feel painful. Understanding these causes and types is crucial because it allows us to approach pain management more precisely. It ties into the overall theme of our presentation, highlighting how personalized treatment can lead to better patient outcomes and improved quality of life. Now let's talk about pain assessment, which is a crucial part of patient care. We use the OLDCARTS method to gather detailed information about the patient's pain experience. That stands for onset, location, duration, characteristics, aggravating or alleviating factors, radiation, timing, and severity. This structured approach helps us understand the pain comprehensively. In addition, we utilize various pain scales to quantify the pain level. These include the numeric rating scale, where patients rate their pain from 0 to 10, the visual analog scale, or VAS, which is a straight line that patients mark to indicate pain intensity, the Wong-Baker Faces scale, particularly useful for children or those with communication challenges, and the FLACC scale, which assesses pain based on face, legs, activity, cry, and consolability, especially in nonverbal patients. It's also important to monitor narcotic sedation scales like the POS and RASS. These help us evaluate the patient's level of sedation, ensuring they are comfortable but not overly sedated. Overall, thorough pain assessment is fundamental for effective management, guiding our interventions and ensuring patient comfort. This connects to our broader goal of providing safe, patient-centered care. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's now talk about pharmacological pain management. One of the foundational concepts here is the analgesic ladder, which guides us through different levels of pain relief. It starts with non-opioids like acetaminophen and NSAIDs for mild pain, then moves to weak opioids such as codeine for moderate pain, and finally to strong opioids like morphine for severe pain. When we use opioids, it's crucial to be aware of the specific drugs involved, such as morphine, fentanyl, and oxycodone. Monitoring for side effects like respiratory depression, nausea, or sedation is essential to ensure patient safety. Another important aspect is patient-controlled analgesia, or PCA. This technique allows patients to manage their pain by administering their own doses within safe limits, which often results in better pain control and increased patient comfort. In addition to these, adjuvant drugs like anticonvulsants and antidepressants can be very useful, especially for neuropathic pain. They work by modifying nerve activity and can enhance overall pain relief. All of these strategies fit into the bigger picture of comprehensive pain management, aiming to improve patient outcomes while minimizing risks. Now, let's explore some non-pharmacological approaches to pain management. On the physical level, things like applying heat or cold can really help reduce pain and promote comfort. Gentle massage and repositioning are also effective in alleviating discomfort by improving circulation and reducing pressure. Techniques like TENS, which stands for transcutaneous electrical nerve stimulation, and acupuncture are additional options that can modulate pain signals without medication. Moving on to psychological strategies, distraction plays a key role by shifting attention away from pain. Guided imagery and relaxing music can help create a calming environment, reducing anxiety and perceived pain levels. Relaxation techniques and cognitive behavioral therapy, or CBT, are also valuable tools to help patients manage their pain by addressing their thoughts and emotional responses. Environmental modifications are equally important. Using comfort devices or adjusting a patient's positioning can make a significant difference in their comfort and pain levels. These approaches highlight that managing pain isn't just about medication. It's a holistic process that involves physical, psychological, and environmental interventions. Together, these strategies support overall pain management and enhance patient well-being. Let's talk about TENS, PCA, and invasive techniques for pain management. TENS, or transcutaneous electrical nerve stimulation, works based on the gate control theory of pain. Essentially, it helps by blocking pain signals before they reach the brain. It's often indicated for conditions like chronic pain, and setting it up properly is crucial, so nursing staff should be trained on the correct placement and settings. Moving on to invasive techniques, these include nerve blocks, epidurals, intrathecal pumps, and spinal cord stimulation. These methods are more aggressive, but can provide significant relief, especially in severe or refractory cases. Each of these approaches targets specific nerve pathways or areas to interrupt pain transmission effectively. It's also vital to monitor patients closely for any complications whenever invasive procedures are involved. These could include infections, nerve damage, or other adverse effects. Equally important is patient education, making sure they understand the purpose of these techniques, how they work, and what signs of complications to watch for. Overall, combining these methods thoughtfully can really improve patient outcomes, but it requires careful monitoring and clear communication. Let's talk about some of the newer measures and CAM, or Complementary and Alternative Medicine, approaches we're seeing today. One key concept is multimodal analgesia, which involves combining both pharmacologic methods, like medications, with non-pharmacologic strategies to manage pain more effectively. This integrated approach can improve patient outcomes and reduce reliance on medications alone. When we look at CAM therapies, we're talking about options like acupuncture, aromatherapy, yoga, tai chi, meditation, and biofeedback. These methods are gaining recognition for their potential to enhance comfort and promote healing, often with fewer side effects. As nurses, our role is crucial here. We need to assess each patient's needs carefully, ensure that these therapies are integrated safely into their care plan, and most importantly, document the outcomes. This way, we can track what works best and continue to refine our approach. Overall, embracing these newer measures and CAM options aligns with our broader goal of providing holistic, patient-centered care that addresses both physical and emotional well-being. Let's talk about integrative care. Comfort, pain, and sleep are closely interconnected, and addressing one can positively influence the others. For example, consider a patient recovering from hip surgery. The type of bed they have, how their pain is managed, and efforts to promote better sleep all work together to improve their overall recovery. Using care plan templates can be incredibly helpful here. They allow us to develop patient-centered interventions that are tailored to each individual's needs. By focusing on these interconnected aspects, we can create a more holistic approach that supports better outcomes and enhances the patient's recovery experience. Let's wrap up with some key takeaways. First, comfort is truly multifaceted and fundamental to patient care. It involves physical, emotional, and psychological aspects, all of which are interconnected and vital for healing and well-being. Second, promoting restful sleep and managing pain are essential nursing roles. These are core to ensuring patients not only heal effectively, but also feel supported and cared for throughout their recovery process. Third, when it comes to interventions, combining pharmacological and non-pharmacological approaches tends to be the most effective. Using medications alongside techniques like relaxation or physical therapies can provide more comprehensive relief. Finally, advances in complementary and alternative medicine, or CAM, along with emerging technologies, really expand our options. These innovations offer new ways to enhance patient comfort and personalize care. So, overall, understanding the complexity of comfort and integrating diverse strategies is key to delivering the highest quality of nursing care. Let's take a moment to acknowledge the key references that have shaped this presentation. First, Tsege and Yezu's 2023 work on non-pharmacological pain management practices highlights the importance of alternative approaches beyond medication. This ties directly into our overall theme of holistic patient care. Next, Majerman and colleagues, 2025, guidelines emphasize best practices for pain management, reinforcing the need for evidence-based strategies in clinical settings. Their insights help us understand how to effectively implement non-drug interventions. Mendonca's 2025 research on sleep-enhancing nursing interventions reminds us that improving sleep can significantly reduce pain perception and promote healing. It's a crucial element in comprehensive pain management. Sale and colleagues' 2023 study focuses on nurses' assessment of pain, underscoring the importance of accurate evaluation to tailor appropriate interventions. Proper assessment is the foundation of effective care. Taha's 2023 work on multimodal integrative interventions encourages combining various techniques to maximize pain relief, aligning with our theme of personalized, patient-centered care. Finally, Jelinaz and colleagues' 2013 perspectives from ICU patients and nurses shed light on how non-pharmacological methods are perceived and valued in critical care environments. Their insights remind us that patient and nurse perspectives are essential in shaping effective pain management strategies. Altogether, these references highlight the growing body of evidence supporting non-pharmacological approaches and remind us that holistic, individualized care is key to improving patient outcomes.